Welcome to Healthcare Today. Nowadays, total knee replacement is very acceptable surgery. If you look around you, in your neighbor or even your family and relatives, you will find a lot of old people. They have done their knee replacement and they are enjoying their life. It has changed the living quality and acceptance of population who are suffering with knee arthritis. But still, there are some reservation is there. Why this reservation? Because total knee replacement cannot give you the results of natural knee. Still, there will be some restriction. Whatever the modern knee implant you use, whatever the surgeon best technique they use, but still you may not able to give the best results to give the full movements of the knee so that one can sit cross-legged or sit kneeling down. This is the reason. Still, a lot of patients, they do not agree to get the knee replacements, or they hesitate to get the knee replacement done, although they are suffering and they can be benefited a lot after the knee replacement by changing or improving their quality of life. Why the knee replacement done? If we understand their things and if we understand the disease process of knee replacement, then we will understand there are some other option also where we can give the all the movements and activity of a natural knee, but still we can do some kind of knee replacement. This is the model of a knee. In this model, if you see, these are the blue color. These are called cartilage. This is the outer aspect of the knee where the small bone is there. This is the inner aspect. And here the kneecap remains. In this model, there is a kneecap. And within the knee, this white two portion, they are meniscus, and in the center there are two ligaments. One is anterior cruciate ligament, another one is posterior cruciate ligament. The role of this ligament is to hold the knee in a center while the movement. When someone is standing, the body weight, full body weight, when they transfer to the knee, the maximum portion, they transfer through the medial side and the anterior part of the knee, because in full extension, this is the maximum contact area. And full flexion, when the knee is 90 degree or more flexion, it remains behind. But that time, in flexion, we do not stand, so we do not transfer weight. That's why the maximum injury happens only in the front part of the middle side of the knee because of these characteristics. In arthritis, osteoarthritis, not only the cartilage get damaged, but also the meniscus and the ligaments, especially the anterior cruciate ligament, they also get damaged. When the anterior cruciate ligament get damaged, then it cannot keep the knee in the proper position and it slides more back, and the wear and tear, they increases. And this wear and tear, they progress to the back and whole knee get degenerated. So usually the arthritic changes in the knee, they starts with the inner side and in a very advanced stage, they can progress to the outer side and the kneecap joint. Most of the arthritic patients who need TKR, they have the changes only limited to this anteromedial part, not in the other part. Other part of the joint, the cartilage, they remains pristine clear and healthy. That's why the partial knee replacement surgery has been developed. This is the model of partial knee replacement. In this surgery, we only replace the damaged part, the inner part of the knee. Even not on the kneecap area, only the femur bone and tibial bone area where the movement happens. This movement happens. We only replace this part. So all the natural things like the ligaments, central ligament, both side ligament, they preserve, which we have to sacrifice in total knee replacements. That's why the movement never remain as a natural in total knee replacements. This is the reason in partial knee replacement one can do all the natural knee movement. They can sit cross-legged, they can sit kneeling, but after total knee replacement, it is not possible. Lot of times it is not possible. Sometimes they may be possible, but lot of times it's not possible. And also the reflexes that comes from the joint to the brain for your coordination, they also maintain, because the reflexes of the joint, they comes from the ligaments, and in partial knee we are not sacrificing the ligaments. That's why the results of partial knee are far better than the total knee. And if we see the total indication for knee replacement for the patient who requires knee replacement to get rid of their arthritic symptoms and achieve a better quality of life, in all those patients, nearly 40% they can be managed with a partial knee replacement. If I can give the better result to this patient with a partial knee replacement, why should I offer them a total knee replacement? That's why I have changed my practice, and I always do advocate my patients when do I believe that they can be benefited with a partial knee replacement. I do advise them for a partial knee replacement. The immediate post-surgery recovery in partial knee is better than the total knee because we need not to do more dissection like total knee replacement, and there's a less dissection, so less blood loss, and the incision is small, so the recovery is very faster, and we do not need to cut the muscles. So it's another reason patient recovers very faster. So the hospital stay for a partial knee 2 to 3 days, but the total knee 5 to 6 days. Partial knee rarely, very rarely they need blood transfusion because hardly any blood loss they have. That's why partial knee replacement patients are very happy than the total knee replacements. Then why there are reservations even among the surgeons? Because in the initial stage, when the partial knee replacement was introduced, the understanding was not so clear. So a lot of surgery was done that time who were not properly evaluated, and that time we have less understanding which patient will get the better benefit and long-term survivability if we offer partial knee. That's why the initial stage, the long-term results was not that good, but slowly the implant, surgical technique, and our understanding which patient will be benefited better with the partial knee has improved a lot. So now we can offer our patients a better surgery, better procedure with a better results. That's why I have changed my practice a lot from total knee replacement to partial knee replacement, where I do believe I can give a better results to them with a partial knee replacement. We care about it.